Cardiovascular disease remains world's number one killer, resulting in 18.6 million deaths in a year. On occasion of World Heart Day, celebrated on 29 September, Brickwork Ratings has organized a heart-to-heart talk with Chennai's renowned cardiac surgeon, Dr. Sanjay Cherian. He is the Vice President and Cardiac Surgeon at Frontier Lifeline Hospital, Mogappair. Coming with over 10 years of work experience, Dr. Cherian's interest lies in minimal invasive cardiac surgery. And what's also commendable is that he has designed and developed India's first 3D printed heart valve in collaboration with VIT. Thank you, Dr. Cherian, for being with us today.
Thank you. Great to be here.
Okay, so on the onset, can you let us know what are some risk factors that lead to cardiovascular diseases?
Okay. Now, first of all, as you mentioned, the most common cause of death in the world today is heart disease. So it's higher than cancers, higher than any form of infectious diseases, any form of road traffic accidents, anything. So the biggest killer in the world is heart disease today. And this is not just in the Western world. This is in developing countries, third world countries, whichever part of the globe we go to, any country in the world, heart disease and its risk factors are the most common cause of death. So coming to the risk factors, the most common risk factors for heart disease would be sugar, which we call as diabetes, right? A very high level of blood sugar in the body, which we call as diabetes. That's the one most important cause. Next thing is in terms of blood pressure, high BP, okay, what we call as hypertension. Third thing is in terms of cholesterol, okay, high cholesterol. So if we take too much of oil in the food, causes a high cholesterol. So these are the three main risk factors. There are other factors as well. It could be like because of obesity, lack of physical exercise, a poor diet, could be even a genetic reason. So if your parents have heart disease, no matter how fit and active you may be, there is still 5 to 10% risk that you could have a genetic factor which itself can cause heart disease. So there are multiple risk factors, right? So it's not just one particular cause which causes heart disease, because many of my patients come up to me and say, "Doctor, I'm a pure vegetarian. Why did I get heart disease?" Or, "I don't drink, I don't smoke, I still got heart disease. How is this possible?" So as I told you, it's a multifactorial disease. And the main risk factors, as I'd like to summarize once again, is sugar, high cholesterol, high BP, okay, lack of physical exercise, obesity, drinking, smoking, any of these risk factors, even as I told you, a genetic factor as well.
Right. So we have been actually also seeing a high population of the youth of India getting prone to cardiovascular disease. Can you enlighten us a little bit about that?
Yeah. See, again, this is a very, very important risk in terms of the young Indian itself. What we see is that in the early generations, most of the people ended up with heart disease at the age of maybe 60 or 70 years old, which was acceptable. It's a part of the aging process. But now what we're seeing is that many of the young Indians, I'm talking about people who are in their 30s, 40s, and 50s, they're the ones who are actually coming in with a heart attack. Very often you see parents bringing their younger children for heart surgery these days, which is like a very scary thing. And if you analyze the reason why this is happening, this again you realize is because of these risk factors that I mentioned about. When we spoke about high blood sugar, it's primarily because our diet has changed. If you look at the older generation, most of the people ate food made at home, good, wholesome, home cooked food cooked at home, right? Where you know the amount of oil and salt that you're actually using. Nowadays, the trend has changed. The younger population, they tend to eat out more often. And when you eat out more often, what happens is that you're not able to control the kind of ingredients that go into it. So the amount of oil, the sugar, the amount of salt, which is added into the diet, that is one thing. Next thing is that the kind of food that we're eating, we tend to eat a lot of processed foods these days. We're not eating so much of homemade, actually natural food. So we tend to eat a lot of things which are coming in a can or in a packet or pre-processed kind of foods, pre-packed foods, which again is not so good because most of them contain some kind of chemicals, artificial flavors, artificial salt, just to hold them fresh, right? To make sure that they don't go bad. So that's another thing. And again, in terms of the kind of drinks that we actually take. We moved away from having a lot of fresh fruits and fresh vegetables, and we tend to have a lot more processed sugars and processed fruit juices, a lot of aerated drinks like Coke or Pepsi or Fanta, Seven Up, any of those things. So those are all containing a lot of calories, a lot of empty sugar, which is there in these drinks. So because of this change in our food habits, that's one major problem that we face. Second thing is in terms of the stress levels. Now, irrespective of what your field of work is, you could be a doctor or an engineer or a businessman or an accountant, lawyer, architect, anything. Especially what we see is people who are in the software industry, people who are in the banking industry, for example, automation industry. These are people who have a lot of targets, right? And they have certain targets that they have to meet. So there's a lot of stress on them. One thing I noticed with a lot of the IT professionals was that they had to work at odd working hours because many of them were doing project works for the US or UK based companies. So their sleep patterns had changed as well. So a lot of stress from work in terms of the kind of deadlines that they had to meet, the kind of working hours they had to put together, long working hours in front of the computer, especially now, because many of the people are working from home now. So because of the pandemic, so they're like sitting for long hours in front of the computer and working. So there's a lot of stress. There's no actual physical activity. And the thing is that people are not finding enough time for physical exercise these days. So these are things, and so what happens again is they don't want to get their hands dirty when they're working, so they tend to binge eat on small eats, a lot of fast foods. So all these fast foods again contain a lot of salt and a lot of oil, a lot of processed sugar. So our diet has changed, our exercise routine has changed. We don't have too much time for exercise, and our stress levels have increased. So, as a combination of all these things put together, the young Indian especially is prone for heart disease. And as we already know, India is the capital for diabetes around the world, which means that we have more Indians in India who are diabetic than the rest of the world put together. So all these combinations put together. The other thing is again the Indian diet itself. The Indian diet itself contains a lot of oil. And now whether you want to have like a crispy masala dosa in the morning, or whether it's like a you want to end the meal with a rasgulla or with a gulab jamun or a laddu. Our sweets are amazing. The Indian sweets are amazing, but unfortunately they all contain a lot of ghee. They contain a lot of sugar. So overall, our diet, our exercise, our stress levels, all these things put together is what is harming the young Indian.
Yes, definitely. Lastly, just one last question. COVID-19 has made things worse. Do you see any kind of myths that you would like to bust for anything related to COVID-19 and cardiovascular disease disorders?
COVID-19 is a very serious and a very real pandemic that we're facing. A lot of media hype, people keep saying that the vaccine doesn't work or the pandemic itself doesn't exist. This is just a media hype. Trust me, I know because I had COVID myself. I lost my family members, I lost many of my close friends to COVID. So I know how it feels. It is a very, very real disease that we're dealing with. So, in terms of prevention, yes, we need to wash hands, we need to wear a mask whenever we can. At the same time, getting yourself vaccinated is the most important form of preventing the disease. So, my sincere request to all the viewers would be that if you haven't been vaccinated, please get your vaccine done. If you're 18 years and above, please get it done. It doesn't matter as to which vaccine you take, please get yourself vaccinated. Getting the vaccine does not mean that you are completely immune to the disease completely. No. There are chances that you may get the virus infection, but the advantage is that the people who have been vaccinated, what we have clearly seen is that the mortality rates, that is the deaths after vaccination, is much less when compared to people who didn't have the vaccine. So many of the people that I lost are people who were not vaccinated. This was probably the first wave, or people in the second wave who didn't take the vaccine. So my sincere request would be please take the vaccine. Another quick question which most people have is that are people with heart disease more prone for complications following the vaccination? Which again is not true. There's no real data. Yes, there is a slight higher risk of clot formation, but you have medicines, you have blood thinners that you can take, oral tablets or heparin injections that we can give you to make sure that you don't get blood clots. But trust me, the chance of having a complication following a vaccination is much, much lower when compared to the people who didn't have the vaccine and who ended up with complication post-COVID infection, right?
Okay. Thank you so much, Dr. Cherian. I think this has been very enlightening for us. And not only that, while we have lost so many lives, we have doctors like you to save many more. So thank you for spending time with us, and see you soon.
It was a pleasure. Thank you so much. Take care. Stay safe.